Board certified obesity medicine doctor here for January office hours every day. Today's question is: compounded semaglutide allows people who cannot afford the brand to be able to have access. Many insurances will not cover, and they are over $1,000 a month. The government has approved the compounded use since there's a shortage. You're telling us they aren't safe because not approved by the FDA, even though they are allowed to be prescribed due to shortages. So this is a great point. And I've definitely made longer videos about this, so you can certainly check them out. Compounded medications really live in this gray area because there was, sometimes there isn't a shortage. And when that happens, the compounding pharmacies can step in to alleviate supply issues. But the problem is it's not, right now, there's not a huge shortage, so that's not required, but also you're really dodging a lot of the regulation has evolved to keep patients safe. And so if you use compounded medications, you are not getting the exact same medication because the pharmaceutical companies aren't selling the active ingredient to other pharmacies who can make it for less money, right? They're not doing that. And also there's a lot of wiggle room in terms of how the medication is prepared. It's not standardized and it's not regulated the way the FDA regulates our medications. So there are many people out there, I'm sure, who have had great results, but from a safety and effectiveness point of view, it's not something that I recommend to my patients. But it is a free country, and people are in America. They are allowed to purchase them. So it's really kind of educate yourself, buyer beware. As a physician, I don't love it, and it's not something that I'm going to tell my patients to do. But it is certainly an option for people out there should they want to pursue it. So I've made a lot of videos about this, and you can certainly check those out on my channel. Go ahead and subscribe to my channel. It's the place for medically based answers to your weight questions.